Welcome back, elite members. Critical video here. Mission critical video and education-based content here. How to prepare for your independent psychological evaluation, why the 31 VA mental health symptoms matter, and how to be uncomfortably vulnerable. Okay, we got a lot to cover today. I don't want to waste any time as we go about doing this today. Everything in this presentation, though, is proprietary and confidential to us. It's for you and current VA Claims Insider elite members only. Okay, so game day. All right, game day showtime. Here are 4 incredibly useful tips. I wanted to hit you with these right away. You're going to be meeting with a US board certified psychologist over a HIPAA compliant telehealth platform called Doxy. Okay, check your email. You should have received a confirmation after you booked your independent psych eval, and it should also be in your email or on your calendar. Okay, and you'll get a reminder of the actual link that you're going to be logging into. Okay, which each doctor has their own Doxy account, and you're just going to log into that. Okay, and it's just a very simple video conference type system that's HIPAA compliant. So just make sure that whatever device you're going to use, laptop, desktop, mobile device, that it's working properly, the webcam works, because they need to be able to see you. Okay, that's part of the behavioral analysis of the evaluation, and just make sure the sound and the microphone, all that's working okay. All right, so you're going to meet with a US board certified psychologist. It's a PhD, so a doctorate level in your state. Okay, now I also put proximity there because there are some states that allow sharing across state lines. Okay, now one thing to note though, fellow vets, is that the US board certified psychologists that you meet with, they exist for you and because of you. Okay, they're used to talking to disabled veterans like you and me every day, all day. This is what they do. They're educated, trained, and certified in this work. They understand the unique needs of the veteran community. All right. There's nothing you could tell them that would surprise them. Okay. They've heard it all. And speaking of hearing it all, this is your opportunity to tell all: the good, the bad, and the ugly. You can't hold anything back. Okay. Because if you do, it's going to affect the provider's ability to get an accurate assessment of your mental health condition. Okay, so the more vulnerable you are with explaining your mental health issues, your symptoms, your behaviors, the more accurate the picture you're going to paint for that doctor, which likely means a better and more accurate outcome. Okay, now a couple things here before you actually get into the appointment. You need to think back here a little bit, maybe write some notes down, and be prepared to talk about your work, your life, and your military history, going back from your childhood. Okay, where you were born and raised, what your childhood was like, when you joined the military, why you joined the military, what you did in the military, if you ever deployed, if there were accidents, stress from the job, right? And then everything into today. What do you do now? Okay, do you work? Do you not work? How are your mental health symptoms limiting or affecting you in negative ways? Okay, and I also want you to be thinking about, when did your mental health issues and symptoms begin? What's the approximate month and year? What caused or made your mental health condition worse? Was it a combat deployment? Was it an accident at home station? Was it a military sexual trauma situation? Was it stress from being in the military, from being screamed at? Were you afraid of failing? I mean, what was it that you believe triggered your depression, anxiety, PTSD, chronic pain, etc.? Okay, be prepared to talk about it. And then, how severe are your mental health symptoms today? Okay, how severe? Are they so severe that it's hard for you to get out of bed in the morning? Are they so severe that you've had to resign from work, or maybe you have a reasonable accommodation to work from home 100% of the time because you struggle to be around people and noise and crowds? Are you suffering from any daily pain? Okay, because of any other service connected disabilities? Be prepared to talk about that. And then ultimately, how is your mental health condition limiting or affecting your work, your life, and your social functioning? And you're going to want to share details about what that means. Okay, so you're going to hear me talk a lot about being uncomfortably vulnerable and why you need to be uncomfortably vulnerable and then what it actually means. So the first reason here is that the truth is going to set you free. Okay. You've maybe been carrying some of these heavy burdens, these shackles, these chains that have kept you bound because these are things you've just never talked about before. And this might even be the first time you've ever spoken to anybody about these things. I get it. I went through this too. So have many members of our team. So have many fellow veterans just like you. Okay. Here's what I can tell you, you're going to feel really good when you're done because you're going to have told somebody your uncomfortable truths. Okay. And the second reason here is I want you to learn something about yourself. Why do you do the things you do? Your behaviors. Why do you act the way that you act? Okay. But this is only going to come out if you tell the doctor everything. And this is the start of us helping you celebrate life change. Okay. So you got to be uncomfortably vulnerable. And then the third reason here, all VA disability claims for mental health, regardless of the disability condition. Okay. There's 31 different rateable mental health conditions. Don't worry about the specific diagnosis. Okay. What you need to be worried about and thinking about is what is your current level of occupational and social impairment, okay, work impairment and life impairment due to the severity of your mental health symptoms. Now, there's 31 mental health symptoms listed in the actual form that the doctor is going to fill out, and it's also codified in the law. So this is what the compensation and pension examiner is going to do as well. So this is your dry run. Okay, this is your practice run to be prepared and be uncomfortably vulnerable. All right, so what does uncomfortably vulnerable mean? Here's what it really means. It means if it's uncomfortable or awkward for you to say, that means you're on the right track and you need to say it. Okay, don't spare any detail. So maybe it means that because of your severe depression and anxiety that you struggle to wake up some mornings. You struggle to get out of bed sometimes. You don't like to do activities that you used to like to do. Maybe you've called in sick to work. Maybe you've become so angry. You have such severe anger issues that you've thrown things or you've punched holes through a wall or you've yelled and screamed at your spouse and your kids and they're afraid of you. Okay. I know this because I've done all these things. Okay. Uncomfortably vulnerable means telling your uncomfortable truths, sexual dysfunction due to side effects of medication and how it's affecting your relationship with your spouse. Okay. Talking about your panic attacks, your nightmares, your severe insomnia, any OCD like behaviors like constantly washing your hands or checking windows and doors multiple times, even after they're locked. Maybe you're hearing things. You hear sights and sounds and you see things that aren't actually there. Okay. I've actually driven people off the road ready to get out and fight from road rage. Okay. That's not normal, folks. That's called grossly inappropriate behavior. And that's one of the symptoms. Okay. So you've got to be prepared with specific scenarios and things that are applicable to you and the things that you're doing. Okay. And then ultimately, you got to remember these three critical elements. Okay. And this is likely what's going to happen in the outcome of meeting with the independent US board certified psychologist. You're probably going to get a medical diagnosis of one or more mental health condition. Okay. Even if you already have one, or even if you don't already have one. Okay. So that's the first part. The second part is, okay, well, what caused your depression, your anxiety, your post traumatic stress disorder? Was it a combat situation? Was it a non combat situation? Or was it something else? What about daily chronic pain? Okay, also called chronic pain syndrome or somatic symptom disorder. Okay, it's also referred to sometimes as a lifestyle impact claim, meaning maybe you've got service connected disabilities in your body that are causing you to suffer from daily chronic pain. And that daily chronic pain, whether it's actually there or not, or whether you just think it is, it's risen to the level where it causes you so much depression and anxiety that it's actually become a mental health condition and an issue for you. That's what chronic pain syndrome is. Okay, this incessant focus on your daily pain and how it's limiting or affecting your life, or your weight gain. Maybe you can't do the activities you used to enjoy doing anymore. Okay, you got to talk about those things. And then ultimately, your overall rating percentage is going to come down to your severity of symptoms. How severe are your mental health symptoms by frequency, severity, and duration? And then how are they negatively impacting your work and your life and your social functioning? Okay, that's what's called occupational and social impairment. Now, I've talked about this, and I want you to remember the number 31, because there's 31 different mental health conditions that can be rated under the law. And there's also 31 mental health symptoms listed in the criteria under the law. Now, something really important, that is not an exhaustive list of symptoms. There's hundreds of possible symptoms that you're suffering from. Okay. So don't be afraid to talk about that. So, for example, a mental health symptom that I suffer from is dry mouth. Okay. I also get tingling in my arms and my legs, side effects of some of the medications that I'm taking. Well, those aren't listed as symptoms under the law, but those are symptoms that can help paint an approximate level of your disability condition to the rater. Okay, so be prepared to talk about all of your different types of symptoms. Okay, now don't be worried about what actual diagnosis you receive. Okay, that really doesn't matter. Mental health is mental health. And even if you have more than one mental health condition, you're only going to get rated for one mental health condition, okay, due to that legal concept, the prohibition against pyramiding. So if you're hearing my voice, though, and you already have a mental health condition, and maybe it's already service connected, but it's at 0%, 10, 30, 50, 70, whatever, and you think you deserve an increase, which is why you're doing the independent psych eval, you need to be prepared to explain to the provider what's going on and why your symptoms are now worse and how you meet the higher criteria under the law. Okay. And by the way, the psych eval and CMP exam prep is critical. So you're doing the psych eval prep right now, but get with your coach and make sure that you do CMP exam prep once you actually get your claim submitted to the VA. Okay, so here's the actual mental health rating criteria under the law. It's codified under CFR 38, Part 4, the VA schedule for rating disabilities. And this is the general rating schedule and criterion for all mental health conditions. Okay, and as you can see, it talks about occupational and social impairment, and it talks about symptoms. Okay, so I think you need to spend some time looking at this chart and getting an understanding of your baseline. Okay, where do you kind of fall on this? How severe is your occupational and social impairment? And what are your approximate symptoms? All right, now you don't need to meet all these symptoms to garner a certain rating. Remember, this is an approximate. Okay, and just because a certain block is checked under occupational and social impairment doesn't mean that that's the actual rating you're going to get. Okay, so try not to worry about and pay too much attention about those things. I want you to focus on your true story, being uncomfortably vulnerable, and sharing the intimate, deep, dark details, the good, the bad, and the ugly about your mental health condition. Okay, so some of the signs and symptoms, and we're going to cover the 31 symptoms, by the way, because I want you to be prepared and I want you to know generally what they are and what they mean. And the reason I'm going to tell you these things today is because I want you to have an awakening and an awareness. If you're like me, I didn't even know why I was doing some of the things I did. I didn't understand why I felt completely alone in a room full of people. I didn't understand how my severe depression and my mood swings from manic all the way to depressive and some of the severity of those swings were really affecting me. I didn't understand why I have to take a nap almost every day. Okay. And so that's why I'm explaining some of these things to you, is to help you understand some of the things that you might be dealing with. Okay. Now, I'm not going to read all of these, but if you've got any of these things going on at all, it's indicative of a serious mental health condition. Okay. So remember the number 31 that I talked about? This is actually from what's called a Disability Benefits Questionnaire, a DBQ, from mental health. Now, when you meet with an independent US board certified psychologist, and after your claim goes in and you have a compensation and pension exam with probably a contracted private doctor, these are the symptom lists on their computer screen, the boxes that they're going to be checking or unchecking. Okay. So I'm going to go through each of these in detail so you can have an awareness of what they mean and if you have it or not. Okay. Again, I'm not a doctor. I'm just sharing information with you today, but I want you to be aware of these things in case they come up. Okay. So remember, we talked about occupational and social impairment and symptoms and how your mental health disability, it comes down to how severe your symptoms are and how those symptoms limit or affect your work, your life, or your social functioning. Now, this is not a hard and fast chart, okay? This is not a rigid chart that is the gospel. It's not, okay? There is no actual specific formula on the number of symptoms or the level of symptoms and how those tie directly to occupational and social impairment or the actual rating criteria under the law. Mental health is inherently subjective. It's subjective in nature, okay? So I want you to think about this, though, that the average VA disability rating for a mental health condition for all veterans who have a condition rated right now is 70%. Okay, those are the symptoms in the yellow. And you can take a look at those. Versus look at when you go to the 100%. Okay, you're talking very, very severe symptoms. Now, again, you don't have to meet all of these. You don't actually have to meet any of these. It really depends on what your specific symptoms are and how they limit or affect your work, your life, and your social functioning. But I wanted you to see this because as we step through the symptoms, hopefully you can have a general awareness of what these symptoms mean and how you might be suffering from them. All right, so let's jump into these and we'll deep dive. So the first symptom is depressed mood. Okay, this is symptom 1 of 31 on that list. Depressed mood, depression is major depressive disorder. Okay, and it's very common and it's very serious, especially in veterans. And the good news, though, is that it's also treatable. So if you've got anything going on like feelings of sadness, loss of interest in activities, maybe things that you once enjoyed like baseball or hockey or reading books, if those are things that you no longer enjoy doing or you've lost interest or pleasure in things, it's possible that you're suffering from some depression. Okay, so feeling sad, losing interest of things, changes in appetite, trouble sleeping or sleeping too much, loss of energy or increased fatigue. Maybe you feel that you don't have a purpose. Okay, maybe things have just kind of slowed down for you. Feelings of worthlessness or guilt, difficulty thinking or concentrating or trouble making decisions. Maybe even in very severe cases of depression, thoughts of suicide. Okay, so if this affects you or this sounds like you need to be prepared to talk about this when you meet with the the independent psych eval, and also during your C&P exam. Okay, so symptom number 2, anxiety. Now, a quick note, anxiety is not the same as a panic attack. Okay, they're different. And so I'm going to get to that here in a minute. But if you're suffering from anxiety or any type of anxiety disorder, it's really a fear. It's an intense, overly excessive and burdensome, persistent worry and fear about everyday life. Okay, and all of a sudden, maybe this can just hit you out of the blue, and you have this extreme fear and panic that hits you. Now, if it peaks, if your level of anxiety gets really, really hot and heavy, but typically peaks in about 10 minutes or less, that's what a panic attack is. Okay. And you might have both. You might have anxiety, constant fear and worry, and you might also have panic attacks. Okay. So those are just some of the signs and symptoms down there. Maybe you're feeling nervous, restless, tense. Maybe you're fearing or there's this impending danger or panic that overcomes you. Maybe there's an increased heart rate, or you're breathing rapidly, sweating, trembling, feeling weak or tired, trouble concentrating, difficulty sleeping. Anxiety symptoms is a GI issue. So maybe GERD and IBS, acid reflux, or irritable bowel syndrome are the result of your anxiety. Okay. These are all very common symptoms, and so many veterans have depression and anxiety. All right, symptom 3, suspiciousness. Do you have trust issues? I know I do. I don't trust people, right? I just don't. And I think it comes with the territory of being a veteran with a mental health condition. And so trust issues could be maybe you're suspicious toward others or because of others, and maybe even their motives toward you. Okay. And so some common signs and symptoms here are maybe, you believe that others are out to get you, you doubt their loyalty, you're hypersensitive to criticism from others. Maybe you have a hard time working with others. You become very quick to become angry and hostile. Maybe you're detached and socially isolated. You can become argumentative and defensive. Maybe you have trouble really seeing that the problem is you, right? Other people see it, but you don't. Okay, again, these are just some of the common signs and symptoms of suspiciousness. Now, symptoms 4, 5, and 6 are lumped together. You're not going to have all of them checked because 4, 5, and 6 are the same thing, panic attacks, at different levels of severity. Okay, now remember, an anxiety is not the same as a panic attack. Panic attack is typically more severe and it reaches a peak in 10 minutes or less normally. Okay. And it includes at least 4 of those symptoms listed there below. But there's just some signs right there of a panic attack: chills or hot flashes, sweating, shaking, numbness or tingling in your hands and feet, dizziness, hyperventilation, which is rapid breathing, heart palpitations, nausea is another common one. Okay. And if you've got any panic attacks going on, or you have these, you need to tell the doctor about them. And you need to make sure you explain the frequency, the severity, and the duration of your panic attacks, because the more severe your panic attacks are, the more indicative it is of a more serious mental health condition. Okay. So here's just a few that I want you to think about. These are symptoms 4, 5, and 6. Panic attacks that occur weekly or less often, that's mild symptoms of panic attacks. Panic attacks more than once a week, those are moderate symptoms. And then near continuous panic or depression that affects your ability to function independently, appropriately, and effectively, that's very severe symptoms. So, do you live in a near constant state of fear, anxiety, panic, and depression? And if so, you need to tell the doctor about this. Okay, symptom 7, chronic sleep impairment. This is insomnia. Okay, there's a joke out there about a veteran saying, "I finally got 8 hours of sleep and it only took me 3 days." And we can chuckle at that, but sadly that's the reality for many, many veterans. Is we suffer from insomnia, pretty severe insomnia. Okay, so some common symptoms there in the right hand side. But if you have trouble going to sleep or staying asleep, or maybe you wake up all the time and you're always feeling tired and you just don't get quality sleep, you're probably suffering from insomnia. Symptom 8, this is mild memory loss. So some of these symptoms now are going to talk about memory loss, and there's mild, moderate, and severe, just like for panic attacks. And so mild memory loss are things like maybe you're forgetting names, directions, recent events. Maybe this is some short-term memory loss, like how to get certain places. Maybe you always have to use a GPS like Waze or Google Maps. Maybe you're very forgetful and you have to keep a notepad with you. Okay. Be thinking about those things if you've got some memory loss. Now, symptom 9 is a more severe form of memory loss, and it's impairment of short term and long term memory and an ability to only retain highly learned material while forgetting to complete tasks. Now, highly learned material are things like basic repetitive tasks that you've done them your whole life. So, how to brush your teeth, get dressed in the morning, go to the bathroom, drive a car, count by fives, recite the alphabet. Those are highly learned materials. And so if you can retain that, it's possible that you've got some short-term and long-term impairment, but it doesn't meet the most severe criteria. But maybe you're also forgetful of things. You read the paper and you can't remember the things you just read. Maybe your spouse and you are having a lot of trouble over, honey, you just don't remember things. Or maybe it's the opposite. Maybe it's your wife who doesn't remember the things that you tell him or her to do. Okay. So you really need to think about your level of short and long-term memory loss. And so I just shared an example here that is applicable to me. I keep notepads with me all day long and everywhere I go, because if I don't write it down, I'll forget it. It's gone. And so that's an example of impairment of short-term memory, okay, and retention of only highly learned material. Now, symptom 10, this is the most severe memory loss, okay? And it's typically indicative of something much more severe or extreme, often found in patients with advanced Alzheimer's. And so, if you've forgotten things like names of loved ones, your job or where you work, or your own name, that would be an extremely severe case of memory loss. Symptom 11 is something called flattened affect, which they should just change the name to severe depression. Okay, that's what it means. And so a person with flattened affect or severe depression, they may not be able to show normal emotions or facial expressions or voice tones. Okay, so a monotone voice, talking like this all the time. Maybe there's never really anything that gets you excited. Okay, maybe something that a normal person it would elicit an emotional response, you don't have one. So maybe you're unresponsive to things around you or external stimuli, or maybe you give an inappropriate response to a positive or a negative event. And so something like this would be, maybe it's a really happy time in your house, your son or daughter or somebody recently won an award, and a normal person would probably get excited and elicit an emotional response and smile and want to celebrate and say congrats. But a person with severe depression or flattened affect, maybe when you found out about something like that, it really didn't affect you at all and you just kind of let it happen. Okay, that's an example. Symptom 12, this is pretty severe speech issues. Okay, and I'm not going to go through these in detail. I'll let you read them on the slide if you want. But the general thing that I would let y'all know, vets, is that very rarely do I see this in veterans. I'm not saying you don't have it, but these are indicative of pretty severe symptoms of mental health. And it could even be to levels of bipolar, so manic depressive. It might be things like schizophrenia or autism. Okay. But you might have these. Okay. Which is why I included this on here in case you wanted to read more in detail. Symptom 13, again, very severe mental health symptoms here. Maybe this is indicative of schizophrenia type behavior. Speech is illogical, obscure, or irrelevant. What's your favorite color? Well, you would probably normally say blue or red, or you'd say my favorite color is blue. But maybe if you have this, you're like, what's your favorite color? I can't believe how busy the roads were today. I'm just tired of this traffic and I get stressed out and I don't like this anymore. And this wasn't just you changing the subject. Okay, this was, you really couldn't comprehend or relate to the relevance of what was asked of you. Symptom 14, difficulty in understanding complex commands. Maybe you've been asked to do something at work and you're having a hard time. You're having issues at work because you don't know how. Maybe you don't even understand what was asked of you and you just can't figure it out in the way that you used to be able to. Okay. And maybe you're also unable to follow complex commands that involve three specific body parts, like right and left side. Okay. Put your right thumb in your left ear and stick out your tongue. You either can't do it, you forget how to do it, or it's really hard for you to think about that. Okay. That would be a symptom of severe mental health issues. Symptom 15 is impaired judgment. Yeah, this sounds like me, right? Have you ever made very bad decisions or poor choices and not thought through the consequences of your actions? So, I mean, here's just some general examples like drug and alcohol abuse, driving drunk, or driving under the influence of drugs. Maybe you've gone out on shopping and purchasing sprees with money you don't have, racking up huge credit card debt. Maybe you've gambled away large chunks of your savings, or you've taken risks that are just way outside the norm of what a person without a mental health condition would do. Okay, that's indicative of impaired judgment. Impaired abstract thinking is really thinking more about what is abstract thinking versus what is abstract thinkers, and how does it possibly affect you. Okay, so here's some things though that I really want you to think about in the attributes and relationships between things, people, objects, and how they connect. Okay, so an example of this to try to make it less confusing is maybe you're having a hard time explaining concepts, events, ideas, attributes, relationships, and how things connect. And if you are having a hard time formulating thoughts or connecting what others might consider to be, kind of basic ideas, you might have some impairment of your abstract thinking. Okay. Symptom 17, gross impairment in thought processes or communication. Again, this is very, very severe mental health symptom right here. Okay, you have trouble forming a coherent thought, or you can't communicate that thought clearly and effectively. This isn't something that we see very often. Um, Symptom 18, disturbances of motivation and mood. This is also a form of depression. Okay. So you're having trouble getting up in the morning. You don't like to do the things you used to do. You're in this constant state of depression. Maybe you used to love to run and work out, and because of your service connected disabilities, it's caused you so much physical and mental pain that you're not able to do those things anymore. You're not able to run or work out anymore. And maybe you've gained a bunch of weight, and that's actually then causing you to become even more depressed. Okay, that's an example of disturbances of motivation or mood. Symptom 19, difficulty in establishing and maintaining effective work and social relationships. So I just put some questions on here to think about. Do you struggle to meet new people? Do you not trust other people? Do you have friends at work or in your life? Have you ever intentionally found yourself not wanting to go to things or events or places? You don't want to socialize. You're not interested in meeting new people. You don't want to go to that event because you're afraid, and you start thinking about, I don't want to have to see people or be around crowds or talk to new people. I don't want to do that. Maybe you just self isolate. A lot of veterans do. I do this. Maybe you self isolate and you bury yourself in your work. You're a high achiever, high performer, and you overcompensate by working too much. Okay, that could be indicative of symptom 19. Difficulty adapting to stressful circumstances, including work or work-like settings. This is symptom 20. Maybe you get overwhelmed easily. You take breaks or naps frequently, especially during periods of stress. Maybe you struggle to even get going or you can't get that first coherent thought on paper because of your anxiety or depression. Maybe that you found yourself just kind of wandering when you're supposed to be doing something. Okay. Maybe you shut down completely and you just want to stay home and stream Netflix or Amazon Prime or Hulu. Okay. Maybe you just want to take a nap and go to sleep. Okay. That's indicative of symptom 20. Symptom 21, inability to establish and maintain effective relationships. This is similar to the previous one, but your inability means you're really struggling. Okay. Maybe people don't like to be around you. Your spouse or your kids are afraid of you. Maybe you've been divorced multiple times, or you've been in and out of relationships over the past few years, or 10 years, or 20 years. Maybe you're just not a good friend. Okay. And by the way, followers doesn't equal friends. Okay. Social media can mask and hide what's really going on in somebody's life. And so please don't ever judge a book by its cover, because you just don't know. And maybe that's you, right? Maybe that's you too, of you just don't really have friends, or you're incapable of being a friend. That's an example of symptom 21. Symptom 22, suicidal ideation. There's two types of suicidal ideation. There's what's called passive suicidal ideation and active. And passive suicidal ideation is when you have thoughts of wishing you were dead or thinking you could die, but you don't have any plans to do it. Okay. Active suicidal ideation is when things have become very severe. And this is when you're not just thinking about it, but you've actually got a plan. There's an intent to take your own life, and you have a plan to do it. And fellow vets, look, you matter. No matter what you're going through right now, no matter how severe the situation is, no matter how bad you think you have it, listen, there's a way out. And suicide is not the answer. Okay? Suicide is not the answer. You matter. Your life matters. And that's why we put the Veterans Crisis Line on here. It's a confidential phone call, the free 1-800 number, 1-800-273-8255, and then you'll press 1. You could also start a secure confidential chat, or you can send a text message to 838-255. Okay. And we listed some warning signs up there as well. But if you've ever had thoughts of suicide, or you're contemplating suicide, please pick up the phone. Okay. We need you. Your life matters. You're here for a reason. God created you with a purpose. Okay. And we want to help you through this. Symptom 23, maybe you perform obsessive rituals which interfere with your daily and routine activities. I know for me, I will routinely check windows and doors that have been locked 3, 4, 5, 6, 7, 8 times over again, or checking car doors or alarm systems. Maybe you have a bizarre number of cameras in your house, like every room or every angle, and you're constantly checking on things. Okay. That's not normal. That would be considered obsessive rituals. Okay. And a few more examples are on here as well, just so you can get an understanding. Symptom 24, this is rage, anger, okay, irritability with possible periods of violence. So maybe you suffer from severe anger issues, which often resorts or can even resort to violence. Maybe you've become so angry with a coworker, a spouse, a boss, that you've thrown things, you've punched a wall, you've hit, you've kicked, you've verbally abused others. Maybe your anger, you can go from calm or okay, from 0 to 100%, go time in just a split second, where you just react and flip out and start yelling or screaming or raising your voice. And maybe you have trouble even remembering the things that you said once you cool off. Symptom 25, spatial disorientation. Spatial disorientation means that you're unable to determine your location or your movements relative to the world around you. So maybe you always drive a motor vehicle with a GPS, like Google Maps or Waze to help you navigate, even though these are the same roads you've driven hundreds or thousands of times. Okay. Maybe you get lost even with a GPS. I know I do. I can have Google Maps or Waze on and I'll still get lost. Okay. That's called spatial disorientation. Maybe you forget where you are or where you're going or why you even left in the first place. That would be indicative of severe spatial disorientation. Symptom 26 here, persistent delusions or hallucinations. This is some of the most severe types of symptoms of mental health. Okay, and so delusional thoughts is when you can't tell what's real from what's imagined. Okay, and versus hallucinations are things like seeing, hearing, touching, smelling things that aren't there, but you think they are. Okay, and there's different types of hallucinations as well. I'm not going to read all of them, but maybe you see things or shadows or people or objects that aren't actually there, or you hear things that aren't there. Maybe you hear voices. That would be an example of an auditory hallucination. Symptom 27, grossly inappropriate behavior. Okay. It's behavior that varies wildly from what a normal person would consider appropriate under similar circumstances. So, have you ever become so angry that you actually threatened or did beat somebody up? Maybe you've been in bar fights or you punched a coworker. Okay. Maybe you smashed somebody's car windows in with a baseball bat because of something they said to you or a look they gave you, or you've slashed their tires. Maybe your road rage has been so severe that you've actually driven somebody off the road, exited your vehicle, and got into some type of verbal or physical altercation or wanted to. Again, examples of grossly inappropriate behavior. Symptom 28, very severe mental health symptom here, persistent danger of hurting self or others. This is you're unable to care for yourself without help. Okay. Not very common to see this, but if you've got any of this going on, please pick up the phone and get seen by a mental health provider immediately. Okay. Very, very serious signs of and symptoms of mental health. Symptom 29, neglect of personal appearance and hygiene. This doesn't mean that you're a constant slob. Okay. This doesn't mean that you're wearing old raggedy clothes. This doesn't mean that you've never bathed or, brushed your teeth. That's not what this means. This means that there's times when you neglect it. Okay. So just be thinking about physical appearance, your home and living conditions, your overall health, and or your behaviors. Okay. And so just a couple common examples are shared here. Physical appearance are things like poor personal hygiene, messy hair, nails, clothes, unexplained weight loss, odors, poor diet. Living conditions, maybe you live in a filthy home, you can't do your own household chores or maintenance, you hire everything out. Rotten smells or foods, maybe you've got health issues that you're not paying attention to, missing appointments, canceling appointments, not taking the medications or refilling prescriptions. Behaviors, social isolation, right? A lot of veterans self isolate and we self medicate with drugs and with alcohol. Okay. So just be thinking about these things before you go into your evaluation. Symptom 30, intermittent inability to perform these activities. It's the same as number 29, except these are very severe symptoms. So maybe you require the daily care, the aid and attendance of another person to help take care of you. Symptom 31, this is the last one, disorientation to place or time. Again, very severe symptom of mental health here. Disorientation is an altered mental state. And so a person who's disoriented, if you're manic depressive, you may not know where you are or how you got somewhere or, what the date and time is. That's what disorientation would be. And disorientation can be accompanied with other severe symptoms as well. Some of them which we've already covered here, like confusion, delirium, delusional thoughts, hallucinations, agitation, wandering. Okay. Again, very, very severe symptoms of mental health. If you got any of this going on, please pick up the phone and get help. Okay, a couple other things you need to know. You got to tell your true story. You got to be open, honest, and uncomfortably vulnerable at all times. You do not need a specific diagnosis. You do not need a specific number of symptoms. It is simply false and not true. Okay. You just need to be prepared about the symptoms you're suffering from and how they're limiting or affecting your life in a negative way. Okay, so this is your action moment. There's a download in here, the Insider's Guide to 31 VA Mental Health Symptoms Revealed and Explained. If you'd rather read more about those in detail, I recommend you review any existing medical evidence or records. So things like service treatment records, VA medical records, private records. You need to be prepared, right? You got to be prepared about your medical conditions and records before your evaluation. And you got this. We got this. We're here for you every step of the way. Okay. Maybe you want to ask a question in the mastermind on Facebook. Do it. Maybe you're feeling nervous, or maybe you just finished your appointment and after you're done, you're depressed, you're stressed, anxiety and panic, all these old ugly things you become aware of again, and now you got a vent. You need to talk to somebody. Reach out to your veteran coach. Okay. They're happy to jump on a call with you and just hear you out. All right. And as always, vets, welcome home. I hope you enjoyed this presentation. You're an insider now. You are ready for your independent psychological evaluation. And thank you for your service, and God bless you and your family.